Hello. So this week, I'm going to talk about a patient experience that I had with a patient who is ADHD, but is also experiencing a little bit of depression. And as we were going through the session, I kind of had it in my mind, just knowing how the provider that I work with likes to work. He doesn't usually change more than one medication at a time. And this particular patient is on the stimulant Focalin and the SSRI sertraline. And in my mind, I just knew that he was going to, because he had talked about it in previous weeks about possibly increasing his Focalin, that it would be something that we would discuss at the next visit. And I knew that because I had prepped for the session and knew that that was going to be something that we discussed, but we weren't aware going into the discussion that he was having more depressive symptoms than normal. And so I was thinking, because sometimes the stimulant can boost the SSRI, I was thinking that he might go ahead and increase his Focalin. And actually he did the complete opposite. He actually increased his sertraline and kept his stimulant at the same amount, thinking that he didn't want to risk rebound depression if he's having depression thoughts right now. And so for me, it was good, number one, in that the provider that I work with has been practicing for 40 years. So he's way more comfortable with stimulants than I am or ever will be. Honestly, I would honestly like to steer clear from them as much as I can. But even just how he went about using them and how they interact with other medications, when I thought I knew what he would do, and then my prediction was the complete opposite of what he did. So it was just really made me take a step back and just really question myself and the logic that I was using. And then I had a good discussion with him after he did that, and it was kind of scary for me because I know it's not going to be a very long time before I am in that situation. But like I said, I'm not super comfortable with stimulants myself, and if there's any way I can avoid them, I would like to. And I know I can't completely, because for the diagnosis of ADHD, and when the patient has that diagnosis, that's what the first line treatment is a stimulant. But I will definitely call on the help of the psychiatrist that I work alongside. So anyway, that was a good lesson for me for this week, and I appreciated the lesson that I had there and just the very limited knowledge and experience that I have. So that was my experience. Thanks so much. Bye-bye.